Okay. All right, awesome. Well, good morning, everybody. I'm so glad that you're here. I expect we'll probably have a few more dribble in, but we're a tiny bit past time, so I want to go ahead and get started. I met Dr. Chunkit Fung at the Rochester Community Table, which you've heard me talk about a lot. And we'll hear me talk about some more today, actually, a little bit in the sermon. And he has just shown himself to be so dedicated both as a medical doctor and as a person who's deeply committed to LGBTQ plus rights and concerns, particularly in the area of trans persons in what's been coming down the pike. And so I've been very appreciative of that as we are here. I'm so committed to our LGBTQ plus community, both inside our walls and outside. And also a very esteemed person in the medical field here, Dr. Scott Hartman, who is the current Monroe County Medical Association president. So they both are just deeply committed to medicine and to medicine in and around this community. So I'm so grateful that they said yes to coming and talking to us about what's going on within the Rochester community, given what's going on in our nation at large. As well as sort of what we can expect to see and how we perhaps might be able to come on board and support their work, for which we are so grateful. So please welcome Dr. Chunkit Fung.
Thank you so much for coming. So we want to use this time to thank Rebecca for inviting us to this amazing congregation to tell us what we do. So my name is Chunkit Fung. I use he, him pronouns. I'm a medical oncologist. But in my free time, I'm very passionate about really fighting for people in the marginalized communities in this difficult time of challenges nationally and in our local community. So thank you for being here. And this talk will be very interactive, right? So it will be casual. We're going to hear from you, want to answer questions, or we'll leave a lot of time for you to ask any questions.
And I'm Scott Hartman. I use he, him pronouns as well. I'm a practicing family doctor and I work for U of R. So full disclosure, I'm not representing University of Rochester in what I say. I am on the board of New York State Academy of Family Physicians, and I absolutely am representing their boards.
Also, I'm not representing University of Rochester. Speaking on behalf as a human being and on behalf of all the people that we have to use our humanity to make good in this world.
Yeah.
Thank you.
Oh,
They're not advancing.
no.
It wasn't earlier.
It was working earlier, wasn't it?
There we go.
Oh, I just didn't hit it hard enough.
Yeah.
All right, so in medical, this is not a medical talk, but in medical talks, we're always supposed to disclose, do we have funding from pharma, anything like that? So I have no disclosures, but
I have, I received research funding from Estella Pharmaceutical, and years ago, I did receive I did consult on Novartis and Excelus.
so these are some just key areas we were gonna quickly talk about each of these and at least a lot of time for Q&A, we hope. Insurance coverage and climate, research funding, reproductive health, and then other kinds of areas that some people call social determinants. We call them social drivers of health. We don't like to say anything determined. We're operating on the principles of medical ethics. And I think these are kind of self-explanatory: autonomy, patients' rights to make their own decisions, beneficence, we're trying to do good and do no harm. So that's the non-maleficence and justice for all, equal access to things like resources and funding. I do want to highlight that the do no harm is a big area. So when you do like research in medicine, that's always the first thing, do no harm. So we don't want to suggest a drug or a surgery or an intervention that would cause harm. It's better to not do nothing, but then there's a tricky balance sometimes because, like, let's say emergency access to a life-saving treatment. So this is the tension that we struggle with every day. Just not hitting that hard enough, I guess. So I think this is probably very well known to people here. I just want to mention it really briefly that the Affordable Care Act, in the view of doctors, is one of the most successful pieces of legislation ever passed. Even though it didn't get us to full universal healthcare coverage, it moved the needle far in that direction through the exchange plans, Medicaid expansion, mandatory coverage of preventive services. So this is tremendous. If you compare us to 10 years ago, my patients that could get a mammogram or a colonoscopy, it's a really tremendous success. And I actually think the most successful part of the Affordable Care Act was Medicaid expansion. If you look at various states and even New York, it was relatively easy to get Medicaid in New York, but now the percent and number of patients that can access Medicaid is just tremendous. And this is probably the biggest thing I think that's driving improvements in population health is that Medicaid expansion. What's at risk? I'm sure you hear this all over the news, right? The reductions in Medicaid from the big, I call it the big ugly bill that was passed in June. The threats to preventive services. So there's kind of a tension playing out here. And those have not been taken away yet, but loss of coverage for preventive services is very much at risk. And then Medicare Advantage. So this is something that started way before, at least a few years before the big ugly bill. But Medicare Advantage is tricky. Like it's sold to people that qualify for Medicare up front, but it's actually a privatization of a public health service. And if you actually look at outcomes, Medicare Advantage subscribers pay more in the end than straight Medicare. I think it's very important to know that because it's sold as this great plan and you have low premiums, but when you actually look at the copays and deductibles over years, it actually is worse. And some data suggest Medicare Advantage subscribers have better health outcomes. Other data shows that their health outcomes are worse. So
I have a question.
Yeah.
Exchange plans, I missed that.
Oh, the exchange are like the Obamacare plans that like the mandated health insurance coverage so that a lot of people that don't qualify for Medicaid and don't have employer-based insurance can sign up on the exchange.
Very little.
Yeah.
So I want to talk about NIH research funding. So I think this is a topic very dear to me because we all do research. That's how our country, really get all these new treatment, new procedures. That's how we improve the health outcomes of all Americans. And this should be a non-political issue to me. So these are resources I got from this website. So I don't even know what indirect cost is when we do research. When you apply for research funding from NIH, you actually get indirect cost. What the indirect cost pays for is doesn't pay, for example, if a medical school, a doctor applies for research funding, they get a grant from the NIH. There's a direct cost that pays directly what the research that goes toward the research. Indirect costs actually pay for the facilities that you are housed at, so that you pay the facilities because you're there. They have indirect costs associated with that research funding, the building costs, the people who maintain the buildings. So they actually cut the indirect cost from an average rate of 28% to 15%. I think there was some lawsuits. I believe that's paused right now, but it has to go through the legal avenue. So what that translates to, that more than 13%. Imagine a medical institution getting $200 million grant. That 15% is close to $20 to $30 million. And when you have that funding cut, especially I'm worried about the rural hospitals, that's a big chunk of money, right? So I'm worried actually these research funding cut would decrease what the medical centers can do in terms of hiring people, ensuring enough staffing. And also I worry about some hospitals that don't generate revenue in the rural communities may actually get shut down. So that and also it prevents researchers from doing the research to advance the knowledge. As you know, White House also terminated thousands of research grants worth approximately $5 billion. Some of them were canceled because of DEI issues. A lot of them were reinstated. There's lawsuit going on, but just that shock that the federal government agree to pay you that grant. They sign a contract. All of a sudden, they said, we are canceling this. So it just, to the medical centers, monies are gone. So what do they do to make up that money, right? And then also, not just they're cutting costs to people, they ousted 1,200 employees, and a known number of employees were granted early retirement and resignations. So that affect what NIH can do, how fast they can, review grants and administrative grant. And then what's concerning is that the president proposed a budget for NIH funding that will cut it from 45 billion to $27 billion. That's a significant amount of funding. It's not passed, have to go through Congress. We'll see where it goes, but the proposed cut is significant. And just to highlight why this is so important is that during 2010 to 2019, out of the 356 drugs that were approved by the FDA, only 2 of them did not have some NIH funding. This is going to slow us down in terms of acceleration of research, what we do as a country, and we're going to lose out to other countries. So, and also I can see other countries already recruiting other prominent researchers from this country to work somewhere else because they're not getting the funding they need. So this is going to affect all of us and should not be a political issue at all.
So this is some information I think a lot of people, again, this is all over the news, the Dobbs versus Jackson Women's Health, the fall of Roe versus Wade. What I think it's really important to understand is that if you were a doctor working in an emergency room in 1950, you would see several cases in an 8-hour shift of people coming in with life-threatening bleeding. That, someone that's having a miscarriage, and how do you treat that? Or somewhat maternal mortality, so maternal death in childbirth, because this is an unintended pregnancy and things that progress. If you look at Argentina, they have really good data from Argentina in the 1980s and 90s, had one of the worst maternal mortality rates in the world. It dropped by 90% when they legalized abortion. And if you look at states that have under the fall of Roe, if you look at states that had the restrictions or created restrictions after this case, these states have increasing maternal mortality and infant mortality. So it's very, doctors like to think in terms of data, and this is what the data shows. So, there are of course lots of threats to reproductive health care, but what I really want to highlight is these things called shield laws. Has anyone ever heard of the shield law? So shield laws, New York and 15-ish other states have passed shield laws to protect reproductive health. This allows doctors in New York or clinicians in New York to provide care to people from other states, so in some limited ways, but especially if they actually come into New York. And it allows the Attorney General to protect those clinicians from legal action in Texas or Florida or elsewhere. It also protects the patients. They have limitations, but we think shield laws are a very important piece going forward in terms of protecting reproductive health. I have had patients come to me recently said that I am afraid to have a pregnancy or have another pregnancy because I won't be able to get miscarriage medication. And I can assure them that New York has very protective laws for reproductive health access, but many other states don't. And I lastly would say that it also is really important to understand that the abortion pill, mifepristone, is used in many other medical scenarios, and it is used in the treatments of miscarriage. So you take away mifepristone, if that becomes illegal, that increases risk of many pregnancy and other complications.
So I want to talk about immigrants and the healthcare system. So I'm an immigrant. I came to this country I was born in Hong Kong and I grew up in New York City because I want to be in a country that actually respect human rights and also celebrate democracy. So that's why I'm in this country. So this is very dear to my heart. So as you know, many immigrants actually have lower rates of health insurance. Many actually are uninsured. And particularly undocumented immigrant because they are not eligible for federal insurance programs, despite what people are saying, they're not eligible. They're not getting a lot of the funding. So definitely that can affect their health. And also they still need medical care. Immigrants still need medical care. So it does they come to the emergency room, we have to take care of everyone, so the cost does get incurred, in regardless of, insurance or not. Also, there are barriers to access, there's fear now of seeking care, and that actually would affect the health of many different immigrants. Many immigrants who are documented may also be afraid right now to seek care, even though they're in this country legally because of what's going on. So we have to be mindful of that. Language barriers, definitely in New York State, and I think many other states in this country, you have to find a translator, right? That's illegal, right? So, but even with that, I can tell you, my parents who don't speak English, it's still a lot for them, right? To go to a medical center, they don't speak the language, you have to find a translators, or like in the middle of the night, it's a lot, so it's scary to them. And the complexity of healthcare system. Imagine, like all of you in this room, you went through it, right? Trying to figure out how to get a doctor's appointment, how to get there, and how to pay for the bill. It's so complex. Imagine an immigrant who are not used to our healthcare system, who do not speak our language, who are just even afraid to seek care. That is so complex for them, and you can see how that can affect their health. And then, and the disparity in the quality of care they receive. There's discrimination, no matter what we say. Like, there are some places when they go, they might be discriminated against, despite what the laws say, and also delayed care because of everything, like lack of insurance, right? And the barriers to access. So that the delay in getting preventive care, or like when they have something wrong, it can really affect the health outcome. So these are all issues that immigrants face in the healthcare system.
And so to piggyback on that, there is research showing that when a clinician and patient are of the same, like race, language especially, but also like race or ethnicity, that health outcomes are better, probably because of communication, maybe for other reasons. But so there, I think it's 12% of our population is Black or African American in the US, but doctors, it's only like 3%. So it's a very significant, and that's actually getting worse since the loss of the affirmative action laws. True for indigenous populations as well. And there's a lot more I could say, but I'll hold off on that. But one of the really striking areas this plays out is the maternal mortality crisis. So the US of the quote unquote developed nations has one of the worst maternal mortality rates in the world. And for Black women or birthing people or indigenous women or birthing people, it's about 3 times of white women or birthing people. So very significant, but some of this we could, there are a lot of ways to address this, that we're trying to address this, but having more Black physicians is probably part of the solution. And then, so in terms of LGBTQ health, I think it's very concerning. The hotline for LGBTQ youth was taken down that helps prevent suicidality. But the research that, so medical organizations, we use those, the principles of medical ethics to create our guidelines, and we also use research. But 3 things that medical organizations very much agree on, like the AMA and the American Academy of Family Physicians, we agree that sexual orientation and gender and identity are not changeable and they're not pathology. We also agree that it is medically harmful to what's it called? Conversion therapy, that's actually medically harmful. So that's unethical in medicine. And then we also agree that HIV care should be fully funded, because funding prevention and treatment of HIV can end the epidemic. We are actually so close. And so, despite the fact that there's a case in the Supreme Court about conversion therapy that New York has outlawed it, and they've reversed that. But so that's very concerning, because these are all things, again, that we as physicians agree on. Lastly, I'll bring up.
Elaborate on conversion therapy.
So that's like, let's say a transgender child comes to their parents and says that they think they're transgender. And someone takes them to a psychologist, and a psychologist tries to do like psychotherapy to reverse what, like, transgender isn't a thing, you're not trans, or you're not LGBTQ. So to try to convert them essentially.
So pretty much concretely, they will give you counseling sessions. Or sometimes worse, they actually might do something even more physical in the old days, you know, they might shock you, like thinking it's a psychology, like psychological disorder, right? They think of it as a disease, a disorder. They would try to get you back to being a cisgender straight person. So just the trauma of going through such therapy, it's very harmful. So that's conversion therapy, yeah, in a nutshell, yeah.
And so one other thing that all the major medical organizations agree on is gender affirming care is not only a human right, but it's scientifically founded. So that it's very clearly demonstrated in research that gender affirming care saves lives. And so again, for the government to try to take that away from people, we would say is medically unethical. The shield laws again, so the shield law that I referred to earlier in New York, we have a reproductive healthcare shield law and a gender affirming care shield law, so that doctors can provide some of this care to people in other states. We think the shield law is really important. The shield law 2.0 was passed in June. It has not been signed by the governor yet. We're very concerned about this, so we're gonna throw out some action items in a bit, but one of those is to get shield law 2.0 passed because it's much stronger and very important for doctors and patients.
So this is we gave a very brief overview, so I think we want to let people feel like you are the power to change. This morning I was listening to a speech about, people are like, what can I do as a person? I'm gonna fail anyway. So you know what? If you don't do anything, you're definitely gonna fail. So do something, right? That's absolutely, if you do nothing, you will fail. So do something. So I have to say, like, this is such a welcoming space for, so just create welcoming space, right? You can make a difference in a person's life. You don't know what their backgrounds are. Just have that open arm and be warm and say, hey, I want to hear your story. How can I be helpful? So I think that is very good, and we praise this church for doing so. So, and all of you here for doing so. There's an election going on right now. So, the media always say off-year election. And yesterday I also learned that there's no off-year election. Every election is an election. Election matters. So please go vote. It's open. And please get your friends to vote. And if you like some candidate, we're not endorsing anyone. But if you like some candidates, the best way to endorse a candidate, say, call your family and friends and I like this candidate because of this. That is better than any organization endorsing those candidates. So please go vote and get people in the city anywhere to vote. You can also do a lot for candidates that you support. We do a lot of that. You can phone bank for them. You can knock doors, you can write postcards and text bank, and they do work. I'm telling you, the best way is actually canvassing, knocking on doors. Second is, phone bank. If you cannot do it, text bank, postcard, anything would help. And get involved, like being in this church already, you're doing a lot a lot for the community. There's all these partners in what we call Greater and Hate Coalition that was formed a few years ago. These are the, I got this from the website. Human Rights Campaign is one of them, which is, I'm on the board of governors. I want to say that. So they are the biggest LGBTQ plus human rights advocacy organization. Asian Fighting Injustice, there's a lot of, they do a lot of good work. Equality Federation, NAACP, Everytown for Gun Safety, National Education Association, National Center for Transgender Equality, National Women's Law Center. So these are all very great organizations. So it's ACLU and all these other organizations. So learn about them, you have time and energy, see what you can do for them, right? So I think that's something that really gives meaning, and we're married, by the way, so it gives meanings to our lives outside of our work, because at the end of the day, as an oncologist, I would ask my patients, right? What gives you, everyone is going through life journey, right? So I always want to learn from my patient. I say, when you reflect back on your life, what do you remember? No one ever says money. No one ever says the accomplishment or anything. They always say it's the difference in someone's life that I have made. So I take that to heart, and I wanted you to think about that very deeply, right? You have the power to make a difference in someone's life during this challenging time. Stay hopeful and joyful. That's how you fight this battle. So, but thank you, and we have half an hour, we just want to be interactive. We know we cannot cover all the major topics, but if we can answer, we'll answer the questions for you.
Can I add one
Yeah.
thing that just, the reason that we kind of threw out those national orgs in terms of like what you can do, and I know that there was a grocery run yesterday, which is amazing, and we know this church does so many amazing things for the community. But my sense, having lived in Rochester about 10 years, is there's this emphasis on fundraising or supporting like what can we do locally, but we have to change things at the state and national level. If those things don't change, things will never get better for many people, and sometimes they'll get worse. And so that's why we really encourage partnerships with some of these larger groups of humans that are doing really good justice work in this world.
So I have a question about what you were talking about earlier with the SHIELD law that you said has been passed, the one to protect LGBTQ plus persons coming from outside other states, is that correct? And that you said it's passed both houses or both bodies, but it has not been signed by Kathy Hochul,
Yes.
is that correct?
The second version.
Shield Law 2.0 has not been
Right,
signed.
so one of the ways that we could respond would be to call the governor's office or to email the governor's office, or, you know, to
Yes.
say, we are in favor of SHIELD 2.0.
Yes, definitely.
The ACLU is the big driver. Well,
But there's a
several
letter
others.
going through.
We have a one pager from the ACLU that I'm happy to email or share, that
Yeah.
it just has like, here's who to call, and I think it has a link that you can send them an email, and yeah, so that's really helpful.
So, and if you have resources like that, that you would send
Sure.
to me, I'd be happy to get them in a
Sure.
list for the congregation to be aware of. Great.
Do you know what the hang up is? Like, why now are they? Or, sorry, that's probably.
No, I think every single policy takes compromise. I think there are different interests, and I think we're hopeful we'll get passed, right? But I think hearing from constituents like all of you would give her more momentum to get it passed.
The big reason we need the second one, so the 2.0 merges gender affirming care and reproductive health care into one bill, but it has a lot more protections for telehealth. So, you know, helping patients in Texas get some care they need.
Without actually physically coming here,
Yeah,
but being able to do it
The
on.
other big thing, it has much better protections for parents and patients. The first one's a little weak on that side, and so it's really important that we're not just protecting doctors, we're protecting the consumers of care.
And also, I like the concept of combining, I think human rights are human rights, right? Women's reproductive rights are human rights. LGBTQ plus people are human right, combining the one and say, hey, we are unified as people, right? I think if we stay unified to say we are together, you cannot really divide us into separate group. That is much more powerful thing, right? That's what they're trying to do with us.
So you had said that, you know, there's still discrimination in the medical field and obviously everywhere, but, coming from the corporate world, there were at least things we had to do every year. You just had to take it, you had to take sex
Yes,
discrimination, those kind of things. Does the medical field force that as well? Or, you know,
do
try
that.
to enlighten people, again, it doesn't necessarily change things, but.
Yeah.
We're required to do all those training to fulfill legal fulfillment, you know, as you know. You can do all the training, but there's still unconscious bias, there's still, so I think that's.
I just wondered.
No, I think. I don't think there's like any legally endorsed discrimination, like it happens.
Absolutely.
Medical schools have a lot more curriculum these
Now,
days
yeah.
about like discrimination and bias and the social drivers of health. Like, do people know that word? I don't know. It's the concept that really most of health outcomes are not about someone's individual choice. That's a very, very small percent. Like, yeah, you chose to smoke, but like A lot of the reasons people get cancer are because they grow up in an environment that's filled with chemicals or other things like that, right? Or
They have no
wildfires.
access to preventive care because of insurance barriers, or they have, food insecurity. They don't have access to food that are healthy for you. So those are the social drivers of health that you have no control over, right? Like, it's just, you're born and, so, yeah. Or like your identity, right? That how you are perceived at the medical field in the community, right? So those are the social drivers of health. Yes.
Could you comment at all on the impact of the defunding of Medicaid on the Rochester community?
Well, I'll say a few words.
Yeah.
I mean, they're actually, just because I go to these meetings with ACLU, the ACLU attorneys, the gossip is that they're really working on ways for New York to fill some of those gaps. As Medicaid is lost, I don't think anyone thinks that we can completely fill those gaps, but there's definitely a very strong will within the New York State government to fill gaps as much as possible. So I think because people in Rochester are worried, as they are everywhere.
Any idea of numbers?
Don't think I could give you numbers. I've seen numbers. I mean, it's in terms of who might lose Medicaid.
Yes.
I think it's in the several million range in New York State, but I don't put you on that.
We can look it up, I don't know.
Yeah.
But it's gonna impact the whole state and Rochester community. And the thing is, these people still need care, and we still deliver care to them when they come to the emergency room, we still deliver care to them. So it's gonna affect everyone. It's not just people who are Medicaid recipient, the cost will go up for every single American. The premium will go up, I mean, it's gonna affect everyone.
I get my healthcare through Trillium Health, which has the Center for Transgender Excellence. And I remember when Patrick Petroni came and spoke with us and shared that there were was it something like 200 people a month were moving to Rochester specifically?
Yes.
Because of the quality of the trans care in the community. It was just mind-boggling, the number of people moving. So this shield law is going to be very, very important.
Yes.
2.0.
How many, Ralph?
Huh?
How many are moving?
It was like 200.
Yeah, a lot of people are looking at this as a safe haven. Yeah.
Mhm. One of the things that I'm really concerned about also, and your thoughts on how this affects healthcare. Perhaps is that on Friday, I understand Supreme Court is hearing. It has a determination hearing as to whether or not they're going to take up the case to overturn marriage equality
Yes.
for gay and lesbian couples.
Mhm.
How will that affect healthcare for folks who are married? Do you have a sense of that?
I mean, probably the partner benefits, right? Because a lot of people in couples, only one person had the health insurance through that person's employer. I think those.
And also for federal, all the federal benefit, right? If you're married and that would apply. Yeah, yeah, so I think. I think the information I heard is we should remain hopeful, but you don't know, we'll see where it lands. I'm still hopeful that we will prevail through that case. That's what I heard. Yeah.
So I was wondering, I know there's kind of a shortage of doctors in our community in general.
Mhm.
And being a boomer, I think I've heard from friends, their doctors retired or passed on, and they're having a really hard time finding a doctor. What's being done to address that, if anything?
Yeah, I mean, you can speak of a primary care physician, that's a lot of shortage.
I mean, one thing I'll say is that there are a couple studies published in medical journals recently showing that states with especially restrictions to abortion access, the numbers of people going into residency there have gone down. And I think that's just kind of a sign, like more progressive policies tend to have, doctors want to live in those places. So I think New York has that going for us, that there are a lot of the things that doctors want in a community and legal protections and all that New York actually has. So I think if you compare us to some parts of the South and rural Midwest, I know there are shortages of doctors here, but it's far worse in some of those.
I think rural areas, I think rural area is another big area for shortage. It's hard to recruit people who work in the rural area. So I think the other thing is also immigration, right? Immigration affect talent coming to this country. So a lot of actually physicians were trained in other countries, but we recruit them, we train them. They go through the same residency program, fellowship to become a doctor. Even if they are attending in other country, we make them go through everything, right? But they still want to become a doctor. So I think immigration policy has a lot to do because we don't train enough physicians in this country to have the growth of the boom, like you said. So I think immigration policy, improving them, making people easier to stay, would be helpful.
Okay.
We have a
Yeah,
question
you wanna add
online,
something?
Lori Mahoney, you wanna ask your question, Lori?
Oh,
You're
Yes.
muted.
Yes. You don't want to see me. Hi, Chunkit, and thank you, Steve. I actually have two questions kind of related to the community work that I do. And one has to do with SNAP benefits. So there's been an all-out effort to work with clients of different, homeless shelters, et cetera, through DHS as well, to make sure they're on exemption. There are different lists of people that should be exempt to ensure that they will keep getting their SNAP benefits when they resume. So the first question is what is the U of R doing? I keep thinking that as people come into the ED, which is kind of primary care for a lot of folks, or, the doctors on, the attendings on the floor, et cetera, is U of R MC doing any screening there? And then I have another kind of related question, if we've got time.
I can't say for the ED, but in medical offices, we have screening questions built to screen for food security or food insecurity. And we do have a U of R. I mean, we can always use more social workers, but social workers are one of my favorite professions. Actually, so important. But there's a relatively good access to.
they connect them with local communities, food banks and different type of local community that we partner with at University of Rochester. So Lori, if there's any other organizations that you are can
Yes.
partner.
Yes, I can send you information from DHS, which is literally the screenings that are happening and how you literally get people on the right list, not just food insecurity, but since it's such a point of access for so many people who aren't in shelters, but to make sure they're on the right exemption list from having their SNAP benefits completely taken away. So I'll shoot that over to you. The other question has to do with nurses, and you talked about doctor shortages and so on. I am incredibly impressed with the nurses. My sister's been at Strong now 5 weeks today, and there is a super large amount of traveling nurses. And my sister-in-law at Albany Medical Center, they did not go the traveling nurse route. They built up a Filipino community and brought many qualified Filipino nurses and their families over to Albany. And so they did not go the traveling nurse route. And is there anything being done, perhaps through the nursing school, to increase our local nurses? Because I do know that traveling nurses, and they sign contracts and their lodging is paid for, and they sometimes can make 3 times what our own local nurses make. What kind of efforts are being done to increase our local nursing population, I guess, is the question.
So when I talk to nursing leadership, my understanding is that the School of Nursing are having a lot of pipeline program. Really, when they train, we have a School of Nursing, right, at U of R, and also a lot of local colleges and nursing schools. So they're trying to recruit and retain those people. I cannot specify what those recruitment, packages are, but what I can say is that they're actively looking at keeping people who are trained in Rochester to stay here. And based on my understanding, when I talked to nursing leadership, is that the amount of traveling nurses actually have decreased during the past year because of these efforts. So they're trying their best to really recruit and retain people who are trained here.
I can speak to that.
Oh, thank you.
I'm not from the School of Nursing, but from the University of Rochester in healthcare all my working life and used to help train nurses. And one terrific thing the School of Nursing has done among many is that they've added programs for people with bachelor's degrees in other areas.
Yes.
Now you can come to their accelerated BSRN program and in about 15 months, go from not a trained nurse to a fully trained nurse. And they started at 50 students per program twice a year. They're up to over 100 students a program 3 times a year now. And every quarter, another bunch comes in. So we're training about 150 nurses.
Wonderful.
There, of course, every single other program in town is oversubscribed. They get 10 times more applicants for the schools of nursing than can be accommodated. MCC is a typical example. You want to be a nurse and go to MCC, you could, really hard to get in because of the huge number of applications. So it's not the trainees, but we do need to keep them. That's no question.
Thank you.
Question on Shabby, I don't. Can you read that? It says, can you say something about the dilemmas that folks in a gay marriage face if they become suddenly ill or injured during travel through states that do not recognize their rights? Do partners lose their ability to speak for their partner during treatment?
Yeah, so this is why we have been at Human Rights Campaign, have been advocating for the Equality Act, which is a federal protection for all, for LGBTQ plus people throughout the whole nation. It's so, to address that question is, you can get same-sex marriage is legal in the whole nation. You can get married legally in a state that actually do not have law protecting you. So you can get married one day, you can get 5 from your job the other day. So this is very, right? Because they don't have, like New York State have all the protection for us. You can legally get married, but in some state you may actually lose. They don't have law protecting you. I cannot remember how many states that don't. So I think, theoretically, if you travel through a state, you get sick and it can happen to you. But I think I haven't heard a lot about that. Have you?
No, I think that
Theoretically, it can
both
happen.
ourselves and
Yeah.
friends have fears of it, though, don't want to travel some states because of that.
Correct. Some of our friends, we don't travel to states that are actively anti-LGBTQ plus right now.
Yeah, the Human Rights Campaign was founded in the 1980s. Shameless plug, they're the biggest LGBTQ plus human rights organization in the country. When they were founded, their initial goal was to pass the Equality Act. They kind of got diverted by the HIV epidemic and they focused all their advocacy around funding for HIV research, that's when they really became a tremendous organization. And then the success of getting HIV funded or HIV research funded, then they moved into marriage equality, but they've always had this desire to pass the National Equality Act and it still hasn't happened. But every time we meet with legislators, we bring this up, we need to get this passed.
Yeah, so I think that brings that to the point, why national policy affects us. You can see it, even though New York State right now may have all these laws protecting their own people, if federal funding doesn't come down and fund these initiatives, we cannot do a lot of the work, so. So to answer your question, Beverly, is we are definitely concerned that can happen, but I don't have the figures to say, in the real world, how often does it happen? I don't know, but definitely can happen.
I have a question that's, I'm asking you to speculate on something I couldn't know the answer to yet. But I'm aware of the effect acutely for people who are postdocs or MD PhDs in research institutions around the country who are leaving or aren't coming because of that. So I'm really concerned about the long-term impact on the pipeline of talent that will get new medical information and medical knowledge into our country. And so I don't know, we're focused on the short term now, but I'm concerned that this impact on the pipeline of talent coming into this country will have a long-term impact on our healthcare.
Definitely. And also the research funding part too, right? To get a drug approved or they're gonna which they approve, it takes years. Just the funding, proposed funding cut for NIH funding, it's gonna affect years to come, right? All these legislature, all these proposals have long-term consequences. It's gonna slow us down for years to come. I agree with you. Yeah, a lot of people are afraid to come to this country. A lot of people are leaving. And these are, a lot of them, I actually look at the discovery, like throughout the past 50 years, a lot of them are, by immigrants. They're made by immigrants, so. We don't want to be like all gloom. I think this is still, I think, I believe in this country, I believe in the humanity of American people. We have to believe in that and we have to engage, we have to believe in the goodness of people. That's how I survived it.
Just, I've been in the homeless sheltering
Yeah.
kind of world for the last 4 or 5 years, and I mean, it's very obvious what's going on in federal and what their intentions are. Oh, and I don't think this is really a question. I think it really resonated with me when you said be welcoming and be good to people. And I think we need to do that in that homeless community. But also, you think about the medical care. They're the worst.
Oh, yeah.
Worst in any sense of that, but the worst people that are gonna be fall away from it as far as healthcare. It's extremely concerning.
Yeah.
Montefiore Medical Center in the Bronx, they have this program where they use some kind of healthcare dollars to fund housing for people with a mental health diagnosis, like sort of severe, like schizophrenia, bipolar. And they have really great data on like how that improved, like the asthma treatment and hypertension, and it's a really, and I think there's some other health or systems that are trying that kind of stuff too, but I think that speaks to the housing first. When you address housing, a lot of other positives fall into place.
We still have 10 more minutes.
Or if you need coffee, then maybe more. Can you bring something that that is positive that you said? Is there a little glitter that you see? I mean, New York State, we're very fortunate.
Yes.
But
What's positive to me is I think every single time there are challenges in this world, there always brings opportunities, right? So I have been reflecting on this a lot, just as a human being. Whatever was going on wasn't working for the American people. That's why American people want to change, right? But maybe the current administration may not be the best administration to implement these changes. So I think whatever was going on likely wasn't working, right, for the communities. So it's broken, the system is broken.
Yeah.
I think there are opportunities for all of us to dream of a system and recreate that right now. And the outpouring support from everyone to really say, hey, I really want to re-engage in this political process, in this advocacy work to make this world a better place. I see that in this community, right? People are coming forth. So this brings me a positive way of looking at it. Hey, it's not working. This is being broken down into pieces. So let's find a way to work together as a country to rebuild a system that works for all of us. And I think I'm more about listening to people with different ideas and even different political point of view. I think if you come from a place of love, compassion, and welcoming for everyone, I think there's so many different ideas to recreate this world, but we all have to agree on some common decency of humanity to rebuild this world. That's how I look at it. So I think there positive things going on, and just like people, they want to do something. So just remember, you can make a difference in this world, whatever that might be. I don't know what we want.
Yeah, I could not say better. Thank you.
Yeah.
You might have covered this earlier, but I might have missed it. But, the work requirements for Medicaid.
Yeah.
What
Okay.
are they? You know,
That's actually in place.
no, it's not in place yet, but it's going to
Yeah.
at some point.
I mean, so there actually is also research showing, first of all, that in states that have tried this, it always drops the rolls dramatically, the number of Medicaid recipients.
Yeah.
And then it drives more emergency room visits.
Yeah,
So that, but it also, there is research showing that those states end up spending more because it's so complicated to get people off the rolls and do all administrative work. So they're actually kind of wasting money, right? So, yeah.
So we don't know I don't want to tell you the wrong thing,
It's
but I'm
okay.
sure, yeah.
thank you.
I think we heard last week that they don't have the people to even monitor, I mean,
That's my
it's supposed to be
thinking.
monitored every month
Yeah.
for them to get the money, so to your point. People just aren't gonna get anything, because they can't even go through the process to prove if they were
Yes.
to any count.
With the deep level of poverty in the city of Rochester compared to the surrounding county and the 5-county area that determines calculation wise what the poverty level is. And which drives then housing, which is totally inappropriate for the city of Rochester, affordable housing, which is totally inappropriate and not focused on individuals. I have to say that I am, at least on this, reading the articles about the recent construction of housing in the city that does provide wraparounds or will provide wraparound services. I think it's just a great step forward.
Yes.
Are you aware of any, what might be future plans in that regard? Because I think that if people do not have the finances to be able to afford transportation.
Yeah.
And don't know how to access medical care and may have some mental health issues and other issues, which would, discourage them from seeking care, especially if there was a barrier to overcome. The idea of a wraparound services seems really attractive to me, and I was wondering in your mention of some of that concern at the URMC.
I think,
Where are we headed?
so I think there's a lot of talks about actually accessibility of healthcare is very important, right? Like, so I think that a lot of talk about how can the major healthcare system, Rochester Regional Health, I think there's a lot of enthusiasm in building something actually where patients need healthcare need. So that's a lot of talk about that, just so you know. So I think bringing the healthcare to where people live and much more accessible is a key. I think it's one of the key things they're looking into, to be honest with you. So I think there's a lot, so there's a lot of that.
Another question online. Lori, you want to ask your
Yeah.
question?
Me again, and my picture looks so much better than me right now.
Oh.
Will you save me sending you an email? And Ralph, I think your ears will perk up, but bringing healthcare, I know there are some URMC mobile units that go different places. We've got a candidate on Flint Street that would be a perfect place to have a mobile unit and provide some basic services and maybe information for other resources. I'm thinking of Graves, Ralph. Who is the contact to make arrangements for something like that?
So Lori, why don't you email me? I would ask around and I will connect you with someone.
Okay, because I know there's some community group, but and somebody was sitting at the table that did that kind of work, but I'm not sure I don't even know her
Is it
name right
Diane?
now.
Is it Diane? Diane Morse?
Could it be Diane Morse? She sits at the table.
Yeah, so I think you can email her and see. She has all the connections because she's part of the community health department.
Okay. Thank you. Thank you.
mobile units.
Yeah,
Trillium is really active in the
Yes, Trillium does a lot of
North
work.
Clinton area.
Yeah.
Humongous center.
Anything else?
Thank you.
Thank you.
Thank you.